More harm than good. That's what's being said about a prostate cancer screening test. We talked to the group that's saying stop using it, and later, the groups that say that the test actually saves lives. I'm Affan Chowdhry. Welcome to Globe Now. There is a blood test that's widely available to doctors. It's the PSA test, and it's supposed to detect signs of prostate cancer. Except this week, a federal panel said that test does more harm than good. Dr. James Dickinson is a member of that panel, the Canadian Task Force on Preventive Healthcare. We've reached him in Calgary. Good morning.
Good morning.
What exactly does a test for prostate cancer? How does it do more harm than good?
What we found when we looked at all the evidence that's available to us is that for men between 55 and 69, it helps maybe 1 in 1,000. So in the group that were given the test, after 13 years, 5 in 1,000 died of prostate cancer. And in the control group, 6 in 1,000 died of prostate cancer. So that's a difference of 1 in 1,000. So that's a pretty small difference. And to get there, at least 27 men had full investigations and treatment. And they were harmed by having had all of that for no benefit.
When you say harmed, how so?
They had the full cancer treatment. These men would have had mainly the surgical operation to remove their prostate. Many of them get left with incontinence, and even more of them get left with erectile dysfunction.
Okay, there's been a lot of reaction to your recommendation to stop using the test. Here are a couple. I'm sure my cancer would not have been caught as early as it was without the yearly PSA testing. Here's another. I'm in my 40s and I'm alive because I had a PSA test. Get it done. What do you say to those people who say that PSA saved their lives?
We simply don't know whether it did or not. The chances are that they would still be alive anyway, because prostate cancer is mostly a very slow growing disease. And by the time men get to their 60s, like me, most of us have it. But what we've got to understand about prostate cancer, it's different from many others. Most of the time, it sits there and grows extremely slowly. So it would kill us by the time we get to 120. So it really doesn't matter.
I've read that mortality rates have dropped in Canada over the years when it comes to prostate cancer. Why do you think that is?
Basically, there was a rise in mortality rates just before the drop started, so that the PSA test arrived just at the time when that was being reversed. We don't understand why it rose, and it's dropping now. But the interesting thing is that countries that don't do PSA testing very much, like Britain, still have a similar drop. So it must be something to do with how we're treating the disease now.
Instead of saying abandon the test because it leads to over-intervention and harm, why not say keep the test and deal with the issue of over-intervention?
Well, that's an argument that's used by Canadian urologists. They say, oh, we don't do things the same as they do them elsewhere or did them elsewhere. We asked the urologists for the evidence for that, and unfortunately they didn't give us any. So maybe they do things differently. Maybe they don't.
Okay, so what is the idea then? Is the idea let the symptoms emerge and then treat them?
It would seem so. In Britain, that's what they tend to do, and they get the same mortality benefit. Because the PSA test is actually quite a good test for following proven cancer. It's just that it's a lousy screening test.
Okay, doctor, thank you so much.
Okay, thank you very much.
Well, we want to hear from you. What do you think about the panel's recommendation on the PSA test? Tweet us at Globe Now. There's been a lot of debate in the medical community about prostate cancer screening. There is a test, and if the advice of a federal panel is followed, that test would be abandoned because it does more harm than good, according to the Canadian Task Force on Preventive Healthcare. Patient groups like Prostate Cancer Canada take a different position. Rocco Rossi is CEO and president of the group, and he joins us now. Welcome.
A great pleasure, and it's not just patient groups, it's the actual clinicians who deal with prostate cancer. This panel is so focused on not having any potential bias that it doesn't actually have prostate cancer specialists on it.
Okay. Some of the harms outlined by the panel, I'm going to read them out to you. It leads to further testing which carries risks, biopsies which can lead to infection or worse, removal of the prostate which can lead to erectile dysfunction, and urinary incontinence. What do you say to that?
Two things. One, the infection risk is less than 2%. So you run that versus people dying or people going metastatic. Two, the single worst cause of erectile dysfunction is death. There ain't no blue pill after that. So we keep people alive. We have options on that front. And the sooner we get to treatment, the better the outcomes.
Okay, on that mortality rate, here's a statement that the federal panel has made public based on its analysis. 1 out of every 1,000 men will escape death because he underwent PSA screening. That makes the test sound like it doesn't save that many lives.
The mortality rate has dropped by over 40% in the last 20 years, in large part because of early detection. So we're talking about 1,000, 2,000 men a year. That may just be a statistic to the panel, which is made up of statisticians, but to us, that's 1,000 tragedies. That's 1,000 fathers, 1,000 sons, that's 1,000 brothers.
But is it early testing, or is it that treatment for prostate cancer has improved so dramatically that when patients present themselves, there is hope?
Look, what we've seen, almost all of the mortality gains have been prior to someone being metastatic. Once a man goes metastatic, we can extend life by a little bit. We can reduce pain, but the mortality curve has not moved. And without early detection, you don't get to that. Prostate cancer has very few symptoms in most men until it goes full blown. And so without early detection, you're basically putting thousands of men at risk of going metastatic.
A lot of confusion has been created around this debate about testing for prostate cancer. What is your advice to men?
Guys, we're our own worst enemies when it comes to health. We don't want to go to the doctor. We don't want to be tested. And if it's health below the waist and we ain't bragging, we ain't talking about it. And that's putting way too many men at risk. And nonsense like this panel's conclusion just gives guys another excuse not to take charge of their health.
Right.
Take charge of your health, get the information, have your risk profile done, have an intelligent conversation with clinicians who actually know something about prostate cancer, and we're going to save a lot of lives.
What has been the game changer when it comes to prostate cancer screening and treatment in the last 20 years?
I think one of the single biggest innovations is actually the Canadian innovation of active surveillance. Is saying, look, we understand that there are a lot of tumors that are slow growth, and therefore we don't want to take men unnecessarily to surgery, radiation, hormone replacement. And in Canada, over 50% of the men diagnosed with prostate cancer are on active surveillance. In the US, it's less than 12%. They go almost immediately from testing to treatment, which can lead to the problems that the task force is talking about. But I think we're doing it rationally here. We're doing smart screening, and we're doing active surveillance, which is distinguishing aggressive from slow growth and ensuring that we're saving as many lives as possible.
Okay, thank you so much, Rocco Rossi.
Great pleasure.
Well, that's all for today's show. If you've got a moment, hop onto Twitter. Share your story about the PSA test and prostate cancer screening. Tweet us at Globe Now. I'm Affan Chowdhry. Thanks for watching.